Joining us now, staff writer at The Atlantic magazine, Ed Yong. And Ed, your latest piece is entitled How the Pandemic Will End. And in it, you write this: even a perfect response won't end the pandemic. As long as the virus persists somewhere, there's a chance that one infected traveler will reignite fresh sparks in countries that have already extinguished their fires. Under these conditions, there are three possible endgames. One that's very unlikely, one that's very dangerous, and one that's very long. The third scenario is that the world plays a protracted game of whack-a-mole with the virus, stamping out outbreaks here and there until a vaccine can be produced. This is the best option, but also the longest and the most complicated. It's likely, then, that the new coronavirus will be a lingering part of American life for at least a year, if not much longer. And, I mean, the science just tells us, Ed, that you're going to have a resurgence or a second wave in America at the very, very least.
Absolutely. It's very clear from all the experts that I've spoken to that this is going to be a long-term problem that isn't going to go away in just a matter of weeks. It may be possible if we do all the right things right now, if we expand testing, if we get enough masks and protective supplies to protect the health workers currently making heroic sacrifices on the front lines, if we stick to social distancing and slow the spread of the virus, and if we get clear, coordinated leadership from the federal government, then the first wave of this pandemic may be controlled to an extent, but it will come back once those restrictions lift. And so for a long period of time, we're looking at probably multiple rounds of social distancing and the need to be adaptive and flexible. But COVID-19 is not going to go away for a while, and we need to steel ourselves for that possibility.
Hey, Ed, it's Jonathan Lemire. The medical community has been talking about this for a while, but I believe yesterday was the first time Dr. Fauci mentioned it from the White House, talking about how one of the waves that could come down the road would be when travelers from the southern hemisphere come to the United States. They, of course, as much as we are warming up, heading into spring and summer, which is believed to help combat the virus, they're heading into their fall and winter. And there's a suggestion that the outbreak there is only going to get worse in the months ahead. Not only bad for them, but then travelers could then, from those countries, travel north and reignite things here. How worrisome is that? What can the U.S. do to try to prevent that?
I think this question of seasonality is really important. A lot of coronaviruses are winter viruses, but this one is finding a world full of immunologically naive people. So whether there's a slight reduction in transmission during the summer or spring in any part of the world, I'm not sure that's going to make enough of a difference. I think the problem both internationally and even within the United States is that the virus is so widespread that unless you stamp it out everywhere, you still get these chances of reignitions of the pandemic, even in places that seem to have it under control, which is why we're going to need to be adaptive and flexible, and we need to prep for the idea that communities will need to go on and off with the social distancing and the upheavals we're experiencing for some time.
Ed, it's Willie Geist. Good to have you on this morning. You do say, in a glint of optimism in your piece, that there is still time to get this under control. What are the conditions under which that would have to happen? Because it seems like we almost as a country would have to pitch a perfect game for this disease to be brought to heel in our country.
Yeah, that's right. We have unfortunately lost a lot of time. America had a decent amount of warning that this was happening in China, and health experts did sound the alarm quite early. But steps weren't taken. We fell behind, especially on testing, and that remains a core priority. Testing capacity is increasing across the country, but it needs to be very carefully coordinated now, as does the supply of masks and protective equipment, which are running so very low. There needs to be a mass logistical effort to ensure that the production is ramped up and is equitably distributed across the country. There are agencies that can do that. There's the Defense Logistics Agency that manages military operations overseas that can help with that. the production of more protective equipment needs to happen immediately, and companies can be retasked to manufacture such equipment at a time when global demand is incredibly high and supply chains are faltering. But you're right, we do need to pitch a perfect game. This is a massive problem, and it requires really clear coordination, and crucially for all the citizens who aren't involved in the medical response or in manufacturing supplies, we need to physically distance ourselves. We need to stay at home to provide the healthcare system enough time to gird itself for the storm to come.
So in terms of pitching a perfect game, the mass logistical operation that you're talking about, Ed, on a scale of 1 to 10, how is the United States doing right now, 10 being the best?
Well, let's just say that there is an index that ranks all countries in the world and rates them according to their preparedness. At the start of this year, the United States had the top ranking, 83.5, a solid B. I think we would probably get an F looking at our response right now. I think a lot of the experts who I was talking to, even people who were pessimistic about the prospects of a pandemic and who warned that we were not prepared, are truly shocked at how badly the US is performing. And this gives me no pleasure to say. It's a really hard thing to watch. It's a really hard thing to watch friends and family in danger. But we can do something. We still have time.
The Atlantic magazine's Ed Yong, thank you very much. And The Atlantic has been doing great reporting on this pandemic. Be sure to check out their website. And still ahead on Morning Joe, Wall Street is bracing for a record surge in jobless claims this morning. Steve Ratner and economist Dr. Jeffrey Sachs joins us for that. Plus, so much more to cover on this fast-moving pandemic. The number of cases in New York has shot up to nearly 33,000, and hospital workers are increasingly at risk. Some, as we've mentioned, even going as far as to use trash bags to cover themselves since they don't have enough protective gear. You're watching Morning Joe. We'll be right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.